Hello, welcome to VMC. I'm Dr. M. Today we are going to cover how you can make visits to the vet clinic less stressful for your pets. This is information everybody with a dog or cat needs to know, so join me. You'll learn something today. When our dogs and cats are young, they go to the vet clinic every month for vaccine boosters and physical exams to make sure that they're growing as expected. When they are adults, yearly physical exams are necessary, and as seniors, being examined at least every 6 months is necessary. On top of that, you'll also have every visit for any accident, stomach upset, ear infection, skin problem, arthritis, pain management, the list of illnesses and accidents and issues goes on and on and on. So visiting vet clinics is going to be a regular part of every pet's life. As a result, it's very important that we put the time and effort into making that trip as good as possible for that animal. One of the first things that every person should be doing is from the moment that animal joins your household, you will need to start working on husbandry training with them. I have covered basics of enrichment and husbandry in previous videos, so we will just overview a little bit with the specific skills for vet clinics here. You want to be teaching your cat and dog to be used to things like physical exams. So that can mean looking at teeth, looking in ears, looking at eyes, using a stethoscope on the chest, feeling the abdomen, feeling the legs, feeling along their back. All of those things are part of every single physical exam, and to have your pet used to opting in for that procedure is a very helpful skill for them to have. And if they're used to how this goes, then it will reduce their stress significantly, which will make it easier for the veterinarian to find anything that might be abnormal. When pets are incredibly tense, it can be much harder to feel their organs in their abdomen properly and to look in their mouths or look in their eyes, etc. So if your pet is cooperative and is not stressed by this event, that is a huge deal. It's also going to be incredibly common that animals are going to need blood draws. So you can work on skills for blood draws and for sub-Q injections, which is how all vaccines are given, but also how a lot of medications are given. You should also work on muzzle training for dogs. Not that all dogs need it ever, but in the case of an emergency, if your dog is very painful, they may react with wanting to bite, and using a muzzle is a huge safety tool both for the dog and for any people that might be around. So if your dog is used to wearing one and it's no big deal, then that's not adding any stress to that visit if they end up needing to wear one. It's also important to teach dogs to get used to stepping up on a platform, as many scales are a little bit off the ground in vet clinics. You can also teach cats how to be weighed. Often it's more of like a baby scale for cats that is used. You can also work on teaching your pets how to take medication on cue. Both cats and dogs can learn how to do this. I've done a video on that already. I'll link it in the doobly-doo for you. So every single day, you should be spending some time with each of your pets working on husbandry things. For my household, I find this is often best in the evenings, as this training is meant to be very relaxing and low-key. So I tend to do this as we're kind of winding down for bed with both my cat and my dog. Maybe about 10 minutes for my dog. My cat training sessions don't ever last that long, maybe 2 to 3 minutes for my cat. Now, you may not be able to make training plans to teach this in a way that is not stressful to your pets, and so you will need to work with a positive reinforcement trainer to work on these behaviors to teach your pets these husbandry skills. They are very important. When working on husbandry at home, part of that is also traveling safely in the car, and there are a number of pets that get motion sick. If that is a potential for your pet, make sure to get Serenia from your veterinarian. It's the only on-label medication for motion sickness for dogs. There's no amount of training that will change motion sickness. You have to medicate for it. It's also important that with husbandry work that you are including happy visits to vet clinics when you have worked up to that step. This means calling your vet clinic, seeing if there's a time that you would be able to drop by. And when you drop by, you only go as close as your pet can handle without feeling any stress. That might mean a number of times that you're simply driving into the parking lot and then leaving. It might take you a significant amount of time to working up to being able to approach the clinic and go inside the clinic. But eventually your hope would be that you can go into the clinic with your pet. They can get some treats from the staff there. They can sniff around. Maybe they get weighed if you want to practice that and they're amenable to it. Maybe they go into an exam room if there's one free. It's simply practicing and showing them that, hey, sometimes we come here and it is just a treat fest and it's a wonderful place to come and you have a great time and then you get to go home. That helps to dilute those times where you have to go in and procedures need to occur. It also makes those procedure days way less stressful for your pet as they have that history of positive experiences that have happened in that location. Another thing that's incredibly helpful is to search for clinics that are doing more work to reduce stress and fear for their patients. Now, not all of them will be certified in any way, but if you find a clinic that has a fear-free certification or a low-stress handling certification or both, or if you find a practice that's certified as being feline-friendly, those are positive things that would make me more likely to choose that clinic. Now, I'm not saying that there aren't people in clinics that aren't certified, that aren't doing a good job, but people that have that extra continuing education are going to be more likely to be doing a better job. Just because someone has that certification doesn't mean they're doing an excellent job. It just improves the likelihood of better handling and a better use of medication to reduce stress. So what I would expect from clinics is that they're working very hard to separate cats and dogs. They may take a cat directly into a cat-only room so that they're never waiting in a waiting area, or ask for you to wait outside with your pets so that there's not a group of animals in a waiting area stressing each other out. They should also be using medication that you would give at home to reduce situational stress. For most cats and a significant number of dogs also need it. You should give medication to your pet the night before and again 2 hours before your appointment in order to reduce the stress that they're going to feel from having their schedule disrupted, from doing the traveling, from the busy clinic, all the weird noises, being poked and prodded. It's a big ordeal. You can also ask when you're booking the appointment to book at the quietest time for the vet clinic. That may be first thing in the morning. Sometimes first thing after lunch can be a good option, as there will have been a bit of a break for the clinic to catch up. It's usually not on the weekend. Weekends are often bananas in vet clinics. Mondays can also often be very busy, so trying to avoid the busier times in clinics can be very helpful. Make sure that you give yourself lots of time to arrive and be early for your appointment. It's also helpful if you make sure your pet is a little bit hungry before you come to your appointment. That way you can bring food puzzles so that while you're waiting for the veterinarian or the veterinary nurse, that you can give a food puzzle to your pet, and that will keep them busy and give them a positive association with being there and waiting for your appointment. Now, the food puzzles and the high-value treats are assuming that this is not a fasting appointment. For a lot of appointments, you can use high-value rewards, like churu is a very popular example, to help your pet have a better association with that visit and to help reduce their stress. If they won't eat, that's also a very clear sign to you that your pet is feeling stressed and that you need to change something about what's going on. So it's also necessary that you learn how your pet looks when they're starting to feel stressed so that you can speak up and say, hey, my pet's feeling stressed, we need to give them a break, or is there a different way to do this? If there isn't a different way to do this, you may have to reschedule at a time when your pet can be sedated. Because if your pet has a bad experience, subsequent visits are going to be so much harder. So trying to push one visit always backfires. It will cause more problems with every visit in the future. Now that also means if your vet clinic says to you, hey, your pet has been too stressed, this is not meant to be shaming in any way. They are looking out for the best interest of your pet and their behavioral and physical health. And so you need to take that feedback and go, okay, how can we change this to make this possible for my pet to go through without becoming too stressed? Now, sedation for things like x-rays should always be done. It's important that you advocate for sedation whenever your animal is needing it. We have a lot of very wonderfully safe sedations and a number that are even reversible. Those sorts of interventions can be game-changing. It's also a very good idea to bring something that is non-slip for your pet to stand on. A yoga mat can work really well for this, and you can use that same yoga mat at home when you're working on, say, the physical exam, so that your pet associates, oh, when I see this particular yoga mat, I know to expect that a physical exam is something that's likely coming. So having those sorts of situational cues can help your pet and bring something familiar so that they're less worried about this new environment. If your pet needs some sort of procedure, make sure to ask about dropping off as close to the procedure as possible, and absolutely make sure that you're giving medication at home the night before and 2 hours before drop off to reduce the amount of stress that your pet feels while they're waiting in the clinic. You should also make sure that you are writing down questions that you have in advance, just to make sure that you don't forget to bring up something while you're in the clinic, and that will help to relax you a little bit if you feel prepared, and your relaxation and preparedness and organization will help to make things easier for your pet as well. Now I'm going to take a minute to address cats specifically, as handling with them can be a little bit different and can take more work, as they don't tend to travel in cars as often as many of our dogs do. So with cats, it's important that they always have a kennel available to them at all times in the house, and that you work on kenneling with them on a regular basis. This reduces that kennel from being a signal of something bad, and it makes putting your cat into the kennel to travel to the vet clinic much less stressful, which makes the whole event much less stressful. I also look for kennels that have easily removable tops or that a bottom can slide out. You should not be shoving your cat into a kennel and yanking them out. That's very stressful for them. Often they will be least stressed if they're examined inside of their own kennel. And so whenever possible, just disassembling the kennel around them, doing the physical exam, and then reassembling the kennel can be best for the cat. You should also work on being swaddled in some towels, as that can be a very effective way to reduce the amount of handling that they require while keeping everybody safe. So working on those things at home can also be very helpful. And a lot of cats, when they're feeling stressed, they may like to hide their face in something. So having towels that they can hide in makes them feel less scared. It should also be noted that for some cats, feel away can be effective at reducing stress. There is an aerosolized feel away, and you would spray the kennel, but you need to do the spritzing with a good 10 minutes in between when you spray the kennel and when the cat goes in the kennel, as we need that aerosol to have some time to dissipate. It should also be noted that the spray feel away only lasts for a couple of hours max. Make absolutely certain that you never spray the kennel while your cat is in it, and that you never spray your cat directly. I will also spray feel away on my scrubs a few times a day, so you could also spray your own clothing. And also for cats, when they are in their kennel, it's incredibly important that you move the kennel safely and properly. A lot of people kind of swing kennels or just carry them by their handle. It's far more stable for the cat and therefore less scary if they're being carried with two hands and level in a stable manner. You should also never put a kennel on the floor if you're waiting for your cat's appointment. Cats feel a lot safer with height, so even having them on a chair beside you or having the kennel on the exam table, covering the kennel with a towel so that they don't see any dogs if that stresses them out. All of those things can be very helpful to reducing the fear that the cat is feeling. I hope that you found these tips and tricks helpful. If you have any specific questions, please leave them for me. I always love to hear from you. And if you have suggestions for topics you'd like me to cover in the future, don't hesitate to let me know those. I do put out a new video most Fridays, so I look forward to seeing you next week. All right, thank you. Bye.